I'm Dr. Rezi, and this is the seventh lecture in the acute pancreatitis critical care station in the MRCS Part B OSCE exam. Okay, so in the last session, sixth session, he asked you about the management. What is your management? Now he is going to ask you about the complications of acute pancreatitis, and trust me, you have a very long list to mention here. Number one, you are going to mention death. Okay, and the mortality rate here is 10% of all cases. Okay, this is easy, death. Okay, next, two, there are local complications, and local complications you can mention many. Phlegmon, pseudocyst, abscess, it may develop ascites, necrotizing pancreatitis, hemorrhagic pancreatitis, fat necrosis, splenic vein thrombosis, no problem. Okay, you can mention all these. Okay, there are other GI complications. Okay, and GI complications like ileus can occur because of these, and there may be bleeding also. You want to remember there are also hepatobiliary complications, and these include jaundice, include portal vein thrombosis, they include involvement of the CBD. All these are hepatobiliary. Okay, so now death, local, abscess, collection, necrosis, whatever, GI, ileus and bleeding, hepatobiliary jaundice, and portal vein thrombosis. We are going to 5 now. Okay, acute in renal system, you may have acute renal failure. Okay, in hematological system, okay, you may develop, or you may have DIC, because this is a systemic illness. You may get shock of all types. Hemorrhagic, you may have actually mostly it is hypovolemic shock because of the loss of the fluids at the third space. It may become septic later if infection happens, so many types are involved here, but shock is one of the complications. Okay, you may have this is here in this case here, you want to remember some other miscellaneous things. Okay, if you want, you can remember, we mentioned shock here, you can remember ARDS, this is respiratory. Okay, you want to remember that you may got multi-organ failure. Definitely before multi-organ failure, you may develop SIRS if you have severe inflammation. So all these are complications. You know, anything will come in your mind will be a complication, but better to keep them in order to show that you are professional. Okay, let us go to number 11, metabolic. Okay, and metabolic, actually you have hypo everything except glucose, hypo everything except glucose. Okay, you have hypocalcemia, you have hypoalbuminemia, you have hypoxemia, you have hypomagnesemia, you have hypo everything except glucose, because you have hyperglycemia. Okay, and that's it. Okay, these are all these are complications. So anything, remember every system and tell that. Respiratory, ARDS, pleural effusion, you can say. Metabolic, all low, glucose high. Any system, renal, acute renal failure, death, local, anything that can occur locally will happen here. GI, ileus, bleeding, hepatobiliary, jaundice, anything, any system you can mention, you will be right. Okay, So these are the complications here. Okay, he's going to ask you another question that it will be better if I involved it here, and he is going to ask you about the TPN, or total parenteral nutrition. Okay, in a severe case you are going to do that. And as I mentioned before, they are trying to use the nasojejunal tube now to bypass the pancreas and the duodenum and give nutrition by the GI, but this is not common yet. So what do you consider in total parenteral nutrition? This is the question. You are considering three things. Number one, you are going to consider the pre-morbid nutritional status. Okay, the pre-morbid nutritional status. This is number one. Number two, you are going to calculate the current nutritional status. Pre-morbid, you see what was the weight before, what was the situation of the patient. Now you are going to calculate the current nutritional status. Okay, and finally you are going to estimate the return to normal feeding. So for how long will we continue in total nutrition? So you are going to estimate also the return to normal. Okay, so these are the 3 points that you want to remember when he asks you about TPN. He's seeking for these three. Okay, the pre-morbid status, nutritional status, the current nutritional status, and the estimated time for return to normal. You have to calculate all these together and put them in your nutritional formula. Okay, well, I will see you in the next session. I think that there are only few information that's remaining.